Hello, everyone. Good afternoon, and thank you for joining APDA for this episode of Unlocking Strength Within. My name is Anushka Sheel, and I am the National Director of Programs and Services with APDA. I am delighted to introduce Katherine Freund, the President and CEO of ITN America. Thank you, Katherine, for being here, and the floor is yours.
Okay, well, thank you very much, Anushka. I am very, very happy to be here. I think this is an incredibly important subject, and I think it's one that people are sometimes very wary to talk about. So I'm very happy to talk about it, and I hope this is helpful and useful to the folks who are listening. So let me just tell you a little bit about ITN America. We are a national nonprofit organization, and our mission is to support mobility for older adults and people with mobility challenges. And we do that through the development of technology. We have software that helps communities support volunteer transportation. We do a tremendous amount of research. We work with the CDC and the FTA, that's Federal Transit Administration. We also do training. We work on public policy, all different aspects of supporting mobility for older adults and for people with mobility challenges. So I think it's important to say a word or two about what mobility means to people. I think it's one of these things we take for granted, but I think it's as fundamental as the difference between being alive as a person, as an animal, if you will, and being alive as a plant. And the big difference is that people and animals, we all move. And when we can't move, it is a terrible compromise for our independence. I think it's also important to know that there's a concept called driving life expectancy, and mobility difficulties are not unique to people with Parkinson's. Most older adults who stop driving in the last 10 years of their life, or for the last 10 years of their life, I should say. For women, it's a little over 11 years, and for men, it's over 6 years, and that's all older adults. So we don't drive until the very last day of our lives. Sooner or later, just about everybody stops. And when they stop, they need a mobility alternative to help them maintain that independence and that mobility. And older adults in the United States take about 90% of their trips in automobiles, either as a driver or as a passenger. About 8% of trips are walking, and only 2% of trips are on any kind of alternative transportation. So automobile mobility is really embedded in the way we live and in our lives, and making the transition from the driver's seat to the passenger seat is a big decision, and it takes place over quite a long period of time. My last bullet point here, Abraham Lincoln did not drive. I put that there because I think it's important for us to understand that we are whole people without being drivers. And many people are not able to drive or move from the driver's seat, and we are still the same people we were before, with the same needs, the same loves, the same relationships. And it's important to understand how to come up with alternatives to driving an automobile. So here are the things that I hope you will learn in this webinar. One is how Parkinson's disease affects your ability to drive safely. Another is how to have a conversation about driving with your family, or for your family to have a conversation with you. That's the big thing that is difficult to do. I understand that. We're also going to talk about strategies for managing that transition from the driver's seat to the passenger seat. It doesn't happen suddenly. It happens over a period of time. And then we'll talk about resources for transportation options as you make that transition. And it's not, again, it's not, you're driving and you're perfectly fine, and then one day you stop and you use alternative transportation. There's sort of an overlapping process. A good process overlaps driving with alternatives and builds your comfort level. So, how does having Parkinson's disease affect driving? There are a number of different ways. One is motor skills. The tremors, the slowness that come with Parkinson's make it difficult to steer. And I'm not holding myself out as an expert on Parkinson's disease. This information came from the United Kingdom Parkinson's Disease Association. So, there are postural problems with Parkinson's, and that affects how well you're able to turn your head, move your shoulders, and see your surroundings. It also affects cognition, which is your ability to think. And that can affect your attention, it can affect your memory, and decision making is extremely important for driving. Visual impairments, I've got a slide coming up on the different kinds of vision that are necessary for driving. And there are, of course, side effects for medication. You should be very thoughtful about driving when you're taking medication. So vision, why do I have a special slide on vision? 90% of the sensory data that you need for driving, according to the Federal Highway Administration, 90% of that comes in through your vision. So that's extremely important. But there's lots of different kinds of vision, and most of us don't really think about this. But here's a few of them. There's something called static visual acuity, and that's the kind of vision that is tested when you look at the eye test and you cover one eye and you look at the big E. That's static visual acuity. But of course, when you're driving, everything's moving around you. Okay, that's dynamic visual acuity, and you need to be able to see those things that are moving around you. There's something called the useful field of view, and this refers to not just what your eyes can see, but what your mind understands about what your eyes are seeing, because it has to do with cognition as well as how well your eyes are working. And then there's, of course, peripheral vision, and you may remember being tested for this at the Bureau of Motor Vehicles. That's very, very important that you retain that, because things can come to you from the side, from either side, and you have to be able to see beside you as well as what is in front of you. Then there's something called contrast sensitivity, and that has to do with being able to see darkness and lightness. So, for example, if you're buying a new car, buy a white car, because that's the easiest car to see. And if you're having difficulty driving in the rain makes it even more difficult to see, and that's because of contrast sensitivity. And then there's something called glare recovery, which is something I've noticed I'm already having a problem with. If I try to drive at night and it's raining and the lights are reflecting in the rain or reflecting on the wet pavement, the amount of time it takes for your eyes to be able to work well again and quickly again when you're experiencing glare recovery is difficult. And it's more difficult as you age. For everybody. Next slide, please, Chris. Okay, so what are some of the other changes? We talked about vision, we talked about cognition. Cognition affects your memory, and it also affects your attention. So there's different kinds of attention. One is divided attention, and one is attention switching. So you know how they say, look both ways before you go? That's attention switching. But divided attention is different than that. Divided attention is, for example, when you're trying to make a left-hand turn across oncoming traffic, if it's an unprotected turn. Protected turn is one of those turns where there's a green arrow and everybody stops and you can go. That's protected, and that's much safer. But when you're, say, on a 2-lane road and you have to turn left across oncoming traffic, so you've got two different things to process mentally. Green means go, but you're not going to go because there's traffic coming the other way, and you have to be able to switch your attention back and forth between when it's safe to go. The same thing happens when you're merging onto an interstate. You have to be able to judge the speed and distance of an oncoming car, and you have to be able to switch your attention between go and don't go. And it gets harder and harder. And then there are musculoskeletal issues, which is your range of motion. You need to be able to turn your neck to see beside you and sometimes behind you. And you need to have the endurance if you're planning a longer trip, that you don't get so tired that, your skills start to deteriorate while you're behind the wheel. And then there's something called proprioception, which was a new word for me, but it has to do with knowing where your body is in space. So, for example, I know my arm is up, but if you're having difficulty with proprioception, you might not know that. And that's extremely important for knowing where your feet are on the gas pedals and where you are in space. Driving is actually an extremely complex task. I mean, I think you can tell from some of the things I'm talking about, and we pretty much take it for granted because it's almost a universal skill. Everybody wants to drive, almost everybody learns to drive, but it's the biggest machine most people operate. It's probably the most dangerous machine that most people operate. And it only makes sense that as we age or as we experience an illness like Parkinson's disease, that the ability to do that safely begins to change. And it's extremely important to pay attention to that for the safety of the driver, for the safety of the passengers in the car, and for the safety of people in the community around us. So just some specific examples for you about how the changes can impact your safe driving. It becomes more difficult to maintain appropriate speed. You see some older adults going very slowly, but you also see some lead-foot older adults who are going way too fast for driving conditions. Both of those things can occur. And it's also more difficult to slow down and speed up and to judge that. It affects your visual field, and I think I've covered that already. But when you think about busy traffic, about cars that are turning, about cars that are stopping and going, about children crossing, about bicycles, about balls rolling out into the road, you have to be able to take all of that in your visual field and assess safety at the same time. And it's extremely important. Night driving becomes harder. I mentioned merging with traffic, that becomes harder. Intersections for older adults are 17 times more likely to crash turning left in an intersection, and 6 times more likely to be involved in an accident with those big semi-trucks that go down the highway. Those are the things to be careful of and watch out for. I already talked about left turns. Changing lanes is another issue that is more complex as your skills begin to diminish. Now, getting lost. If you are getting lost when you are driving, you really should begin to think about finding alternatives immediately. That's a strong sign that your cognition is impaired. And you may have heard about these gas pedal accidents that occur. That happens when people have neuropathy. They can't feel their feet as well. And it also happens because people are mentally confusing the gas pedal and the brake. You may wonder how people, can keep going when it's clearly dangerous. It's because they think they're stepping on the brake and they're stepping on the gas. Anybody who's having accidents like that, please see a doctor, see an occupational therapist, but it's very, very dangerous driving. Next slide, please. So this is a slide that describes behaviors that commonly happen and that are really they compromise safety a lot. The first one is called copiloting, and that is when one person is driving who maybe isn't thinking so clearly or can't see very well, and another person is trying to compensate for them and saying, okay, it's safe to turn left now, or the light is green, you can go. Co-piloting is extremely dangerous, and if you are doing it, please think about finding alternatives. Medications, we mentioned already, obviously. Drinking alcohol, don't do it. Don't do it when you drive, even a little bit. And the next one, garage rash, I have to say I named that one. That first dark picture there, there should be a term for proprioception for cars, because at a certain point, people don't know where their car begins and ends. And garage rash is people who are pulling into their garage and hitting their garage, or running over garbage cans, or running over mailboxes, or hitting the drive-through teller. If that's happening to you, again, that's a sign that it's time to make the transition from the driver's seat to the passenger seat. If you're getting lost, that's another one. If if you left home to do an errand and you're getting lost getting home, that's another sign that it's time to find alternatives. Okay, next slide, please, Chris. Thank you. So this is about having conversations with loved ones about driving. And I think, the conversations can happen with adult children, spouses, sometimes grandchildren are involved, sometimes neighbors and friends. But I think it's very important to treat this conversation as an act of love and caring for someone. Many people think it is a confrontation or an intervention. It's nothing like that. It's nothing like that. I will say, speaking with my parents, the first thing I said was, I know you want to be independent. I know that everybody does. And I want you to be as independent as it is safe for you to be. So can we please have a conversation about what to do if the day comes when it's not safe for you to drive? And it comes to almost everyone. So, what alternatives are there for you when you need to think about the transition from the driver's seat? I don't have data on this, but I believe the transition happens over about 10 years. And I can tell you that crash risk goes up quite dramatically at 75. And I just turned 75, so I'm now looking at this. But for our system, Independent Transportation Network, I can tell you that about 57% of the people who use ITN have a license, about 37% have a car, and about 25% are still driving. And over the course of using the service, they make that transition to the passenger seat. And, I like to say that's why cars have seats for passengers. You don't have to be the driver. You can ride in a car and be in the passenger seat. Mobility is essential for all of our needs, to get to healthcare, to get to nutrition, to have a social life, to go to the library, to vote. We need mobility for all of these things. And it's not just going to the doctor. I can't even think about a life where all I did was have a ride to the doctor. There's all the things we need to do and people we need to see and places we want to go. So it's really important to have a plan for your mobility while you're still driving, and help you make that transition, and how your family can help you think about that. And I think it's important to engage and involve the people who are making that transition in the decisions and in the activities needed to find alternatives and to make a plan so that you're not, I think the word is infantilizing. You're not infantilizing an older adult. It's insulting for people, and everybody appreciates being respected and having a conversation that is about keeping people safe and independent and showing that you love them and you care for them. Next slide, please. Okay, so use the skills and people that you have. This can be a conversation with many different people. If there are other people in the family who have different kinds of expertise, you might want to have, say, someone who's an expert in insurance, talk about insurance and driving, someone who's in a healthcare profession, whether they're a nurse or a nurse's aide or a physician or a physician's assistant, or just even someone who is familiar with healthcare. In my family, the conversation I had with my sister, who's a dentist. And so different people can talk about the transition and talk about different aspects of it. And it's connected to other forms of aging. Do you have a list of your doctors? Do you have a list of your medications? And have you looked into alternatives? But I think if you begin with love and have the conversation. Also, it's nice, take a walk outside so somebody doesn't feel trapped or cornered when you're having this conversation with them, because it's a tough one. And take your time and have many different conversations. Don't expect this to be one and done. It isn't. It's a decision. It's an internal, it's a personal decision. It happens over time. And talk to your family and have different people in the family help, I think. Okay, next slide, please. So resources for alternative transportation. Those are all pictures that I found for transportation: the horse and sleigh, the motorcycle, the sailboat, and I don't know if you can tell, but there's a little baby swan riding on somebody's swan back there. There's transportation everywhere. The first section, I already gave you that information. 90% of trips are in cars, and so that's really what most people want. And there is public transportation, and there are rideshare services, but they're not in every community by far. 60% of the population of the United States doesn't have access to Uber and Lyft or rideshare services, and 45% of the population of the United States lives in a community where there is no access to public transportation. So cars are really important, and coming up with a way that you can ride with your family and friends, that has difficulties because asking favors gets old really fast. So trying to line up a network of people who can help you with the rides is important, and maybe you can work some kind of a trade. I knit for everybody. I make apple butter and strawberry jam, and I give it away all the time. I'm sure there are things you do that you can trade. And there is, of course, public transit and taxis. If you are in a community that has taxis, you're going to want to find out in advance which taxis you think you want to use. And I really encourage people to try other forms of transit. And it takes the unknownness or fear out of it, gets you familiar with it. And you might want to take a family member or a friend with you to try those different modes. So these are the different kinds of choices: riding with family and friends, using public transit, using a taxi, using a rideshare service. And then there are more than 1,000 nonprofit transportation organizations across the United States. And those, each of those services, you should explore which ones there are in your community. So I want to bring to your attention a service that is available. It's called Rides in Sight. It is available on the internet, and you can Google it and find it. It has a toll-free hotline. That's the number, I'll say it out loud if you can't read my slide. It's 855-607-4337. That's a toll-free hotline, and it's available from 8 a.m. to 5 p.m. Monday through Friday, Eastern Time. And if you call that number, a person will answer. If they're busy, they will call you back the same day. And they will ask you a series of questions to help them identify the transportation alternatives that are available in your community according to your needs. They'll ask you what type of a trip you want to take. Are you going to healthcare? Because some services only do healthcare rides. Some services will do other kinds of needs like grocery shopping or personal needs. They'll ask you how far you want to go, and they're going to ask you if you need mobility assistance. That is, do you need a wheelchair? Do you use a walker? Or do you need someone to escort you into the building? And then they'll help you find whatever's available in your community. You can also search that database yourself, and it is free online. It is supported by Regeneron Pharmaceuticals, and it has more than 10,000 transportation providers in it. It's the only database of its kind in the country, and you can search it yourself. And if you have any questions about how to use it, you can call that hotline number and they will help you. It is supported by human being researchers and trained people who answer the line, but we also have recently rebuilt it, and we've put some of that artificial intelligence into it that you've been hearing about, and it has really added many, many, many new providers. So we can search Facebook pages now, and we can search websites, and we can search the internet. So it's very comprehensive and it's very current. And it is sorted so that all of the nonprofit providers come to the top of the list of the services that are available for you. It has a lot of different fields, 40 different data fields. I think that's it. Something else I was going to say, but slipped my mind. Anyway, this is my contact information, and you can feel free to call me. That's my personal number. If I'm real busy, I will get back to you and ask you to be patient. That's also my email, or you can reach me through our website, ITN America, and you can email me at info@ITN America. We're going to take some questions now. I think we have a few more minutes, and Anushka, I think, is going to help me with this. And if I can't answer your question, you can send it to me and I will answer you later on.
Katherine, thank you so much for that thoughtful presentation. We have many questions that have been submitted from our audience members at the time that they registered. So I will just get started with the first question here. Someone has asked, is there a way to get discounts for Uber and Lyft if you can no longer drive?
I do not believe there are any discounts for Uber. I think there is a slightly reduced fare for Lyft. But I would suggest to the caller or the questioner that they also search for nonprofit volunteer transportation programs. Many of them charge nothing at all. And those that do not charge the true cost of the ride, because they're nonprofits and they are often supported by foundations or charities or nonprofit fundraising efforts. So those are also available.
Absolutely. So again, you can go to Rides in Sight and the ITN America website to look at some of those nonprofit services that are available.
Right. They're mission oriented. Sometimes you have to schedule a ride in advance. It's not on demand the way the smartphone enabled rideshare services are. But there's generally a very big difference in the cost.
Absolutely. So I think that you did touch on this a little bit with your presentation, but someone has asked, I live in a rural community. There's no Uber, there's no Lyft, there's no DoorDash. The only dial a ride is for the town, and it's booked way in advance. How do I do regular errands and shopping, especially with a mobility device? Is alternative transportation covered by insurance?
Okay, a lot of different questions there. Alternative transportation is in some communities covered by Medicare Advantage plans. And so people can check their health insurance and find out if their insurance will cover that. That's the only insurance that I know of that covers transportation. And Medicaid covers it. Medicare, I believe, does not. Unless there's an Advantage plan, then it covers it. And what else did they ask? In rural communities, again, I would go to Rides Insight, because if there is a transportation nonprofit in that community, that's a lot where the nonprofits come in, where there isn't, the rideshare services, that they're profit making. So if there's not enough population density for people to make a profit, they tend not to be available there. And the other thing about the rideshare services, they're independent contractors, and they are not required to provide assistance for anybody. Whereas the nonprofit volunteer programs, they're doing it for a mission. They're mission oriented, and so they help people with packages and so forth. I'm not saying Uber and Lyft don't do that. All I'm saying is that as independent contractors, they cannot be told by Uber and Lyft that they should do that.
Absolutely. And I do want to add, this person mentioned that they have a mobility device. And Catherine, I know you mentioned that, with Rides Insight, there's a way to opt in to filter for transportation that includes mobility devices.
Absolutely, yeah. And there are a lot of different kinds of mobility devices. These little rollators now are very, very common, the ones that people push, but then they can roll them and they can sit down on them also. And I think people use those very commonly now, or walkers. And some people still use canes. So those mobility devices, people really appreciate help loading them into the car. And some people must get on a wheelchair lift, but my experience, speaking from my experience, is that most people are not in wheelchairs. Most people have walkers or canes or rollators. And even people who have wheelchairs, if they're using a volunteer program that doesn't have a wheelchair accessible vehicle, if their wheelchair can be folded and put in the trunk, and if they have enough muscular strength to transfer to the front seat of the vehicle, then they can still ride in a sedan.
Absolutely. Thank you for sharing those details. And we have another question from an audience member. The audience member has asked for tips for determining when it's time to stop certain types of driving. You mentioned in your presentation things like night driving, freeway driving, or stop and go traffic, because this person is experiencing slowness of movement on one side of their body. And they said on a bad day, their reaction time is definitely impacted. Do you have any advice to share?
Yeah, I would say, first of all, you can see an occupational therapist and get an assessment. And I would recommend that. They'll give you a professional advice. But I would say, if you're feeling those changes, listen to your body, and begin to make some plans for alternative transportation, and try those transportation services out. You may find that Uber and Lyft are available to you. You may find that you like them, but they're too expensive. You may find that there are volunteer programs. And a lot of times, one program will do one kind of ride and another program will do another kind of ride. People refer to this as a quilt, a patchwork of services, but big deal. Food is a patchwork too. Is it Mexican food? Is it Chinese food? Is it Italian food? There's all different ways to do things. And there's all different ways to provide transportation. We're so used to thinking, well, I got my car and that's my transportation. But when you get into alternatives, it varies a lot. And, the key thing is being mobile and as independent as possible and being safe. So the more you can look into the options, the more you're in control of your own self. And we all want it. I know that.
Absolutely. Catherine, we have a question here from an audience member, David. And David's question has actually been echoed by some other pre-submitted questions. He's asked if the driver is diagnosed with cognitive issues or decline like dementia or Parkinson's related cognitive issues, what are the legal and financial risks, such as injury lawsuits? Can insurance refuse payment?
Oh boy. I don't know the answer to that one. But I really think the larger issue is if they're experiencing cognitive change, they need to immediately make a plan and find alternatives. I wouldn't play with that at all. I really wouldn't play with that. You drive when you're not thinking clearly and you hurt someone, you run over a pedestrian or strike a child. Nobody wants to live with that. Nobody wants to live with that. And denying that there's a problem. My personal motto is reality never goes away. So the more you deal with it, the better it is. And would insurance cover it? I think I can answer that partially. Insurance is a state issue, and different states have different reporting requirements. And I actually looked this up. I picked 5 states at random and asked if it was mandatory to report Parkinson's disease. And it's different in all the different states. So for everybody listening, go look it up for your state. In Maine, it is a mandatory self-report. So if your insurance company, I don't run an insurance company, but if it was mandatory that you self-report and you didn't report and you get in an accident, I would be worried about it anyway, but you should ask your insurance company. In New York, there's no requirement to report, at least that I could see. But if you live in New York, you look it up for yourself, please. In California, physicians must report a condition that impairs driving. They must report that. It's not specifically Parkinson's, but there are a lot of conditions that impair driving. In Florida, I couldn't find any requirement to report. In Pennsylvania, physicians are mandated to report. And in Colorado, there was no requirement, but there was a recommendation for self-reporting of any condition that would impair safe driving. So it's different in different states. And I would imagine, this is not legal advice, that the insurance is applied differently in different states as well. So
thank you.
Yeah.
Thank you for giving us those examples of specific states, because we have viewers from across the country. So that was really helpful.
Okay.
And someone else has asked for funding resources for alternative transportation. Like, for example, are there vouchers that people can apply for through their county or through their state? I know you mentioned Medicare and Medicaid.
Yeah. Oh, vouchers is a good point. I wouldn't have thought of that. Often they're for taxis. You have to look locally for for those opportunities. But I think it's also important to remember in the United States, the average household spends 17% of income on transportation. So if you don't have a car payment and you don't have maintenance and you don't have registration and you don't have gas and you don't have brakes and you don't have tires, all of those dollars that you were spending on your automobile, take a certain amount. Say you were spending, I mean, I just had a $2,200 bill for rust under my car, right? Take the money that you were spending on your car and set it aside in an account and think of that as your transportation account. We're so accustomed to public transit subsidizing trips that we think if we don't drive, it should be cheap or free. And transportation is actually very, very, very expensive. So please plan for it, and that will preserve your mobility and your independence. And as my aunt used to say, take your hand away from your heart and pay for it. Because it's expensive. So.
Yeah, absolutely. That is a really good point. And, following up on something you said about the taxi services and vouchers, say that someone is interested in, getting vouchers for a taxi service. Who would they contact? Do they contact the taxi company directly? Do they contact their local area agency on aging to ask about transportation resources?
I would say for taxi vouchers, they're usually public funding. And so it would be county or town is most likely. They could also call the taxi companies, but there are a lot of different taxi companies. And if it's a taxi company that doesn't take vouchers, you may not get the answer you need. So I would go to agencies on aging, may very well have that information, or they may not. But that's a really good point. In my experience, they are funded by local governments, county, city, town, something like that.
And that actually echoes the experience of someone in the comments here. David Miller says his town has a Lyft program where the person pays the first dollar, the town pays the next $10, and you pay for anything over that.
That's a nice, what town is that, David? That's a nice program.
Yeah, David, if you can put that in the chat, that would be helpful. And someone else has shared Hitch. Dina has mentioned Hitch is a service for city-to-city travel. It's an app, and it's not just for older adults, so for other people to utilize as well.
Good.
Yeah, and I have another question that has come in from a care partner perspective. And the care partner has asked, how do I get my loved one with Parkinson's to understand the need to stop driving?
Well, I think I kind of covered that, but I'll say it again because it's really important. From their perspective, they want to be independent. And what I said to my parents was, I love you, I want you to be safe, and I want you to be independent, and I want to help you be as independent as it is possible and safe for you to be. But in this case, since you have Parkinson's, and since that affects your ability to think clearly, your ability to move, since you're taking medications or maybe taking medications that will affect your safety, it may affect your vision. Can we please make a plan for how you will get around when these changes become so great that it's necessary for you to start making the transition? And, can you, mom or dad, look around for these, or would you like me to help you? I want you to be independent. I want you to be safe. Nobody lives forever. nobody gets away with not having changes when they age. It's more exaggerated for Parkinson's, but it happens to everybody. And so making that plan to preserve independence and safety is really, that's the light at the end of the tunnel. That's the path forward. And to do it before you're at the end of your twine, before you hurt yourself, before you hurt somebody. That's the thing you want to avoid. You don't want to hurt anybody. I believe that nobody wants to hurt anybody else.
Yeah, I think, Katherine, thank you so much. That's a very compassionate script that people can keep in mind as they're preparing to have this conversation with their loved ones. So I believe that is all the time we have today. But Katherine, can you share again the phone number for ITN America in case people want to reach out and get in touch with their transportation related questions?
The only number I use is my personal number. I gave the Rides in Sight number out. I'll give my number again. It's 207-415-1630. And I also did want to mention to people that we have 111 nonprofit transportation providers in our national network. And if we can help anybody connect with those, we would. They can search it online, our website. And we also have a program, if people live in a community where there are no options, we help communities start up nonprofit transportation programs. So I just wanted to be sure people understood that.
Wonderful. I really encourage all of our viewers today to check out ITN America online, give them a call. And Katherine, on behalf of APDA, thank you so much for being here and sharing your expertise with our audience. Thank you to all of our viewers for joining us today. And we hope to see you at a future APDA broadcast. I hope you have a wonderful rest of your day. Take care. Bye.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.